We're just going to a few more minutes for people to join, and then we'll go ahead and all righty. I will go ahead and get started. Thank you for joining us today to review the University of Maine System's 2026 Open Enrollment presentation. My name is Carla Varna. I'm the Director of Total Compensation for the University of Maine System. I'll be guiding you through this year's open enrollment process, highlighting key changes and helping you understand your options. So how this has been working when we've been doing these live is that I kick off the presentation and then I introduce some of our vendor partners who have been on the road with me, and they will queue up their presentations and then they'll run through their slides. And it's been taking us around an hour and a half to 2 hours to get through all the presentations. And then when we're done at the end of all of our presentations, we open it up for questions and answers, and we'll help you. We'll make time for that as well. I did just want to say, for those of you who have not seen the news, Anthem and Northern Light Health have reached an agreement. So Northern Light Health providers and hospital systems will be in network for when our benefits are effective, which is they're actually in network now, but our benefits are effective January 1st, 2026. So open enrollment is the annual time of the year to make your benefits elections. And this year we're hosting our open enrollment from November 3rd through the 24th, with, as I mentioned earlier, elections being effective January 1st, 2026. We have various options in which you can connect and ask questions from the UMS Employee Benefits Center team, and their information is provided at the bottom of each slide as we navigate this presentation. And also, you can find more information posted on our public website, so you can take time in the evenings to review information with your spouses or family members. There we go. All right, so for 2026, our changes and highlights are that we're updating our healthcare and prescription benefits. You can view updated rates for both the Anthem copay plan and the Anthem high deductible health plan by logging into your Main Street Employee Self-Service and selecting the open enrollment tile. Starting January 1st, prescription benefits will be administered through Capital RX. And this is a change because previously Cigna had both of our medical and prescription benefits all rolled into one. We envision that feel will still be the same, even though we have Anthem handling our medical plans and Capital RX handling our prescription benefits. Capital RX will feed the claims information to Anthem, so it will all queue up. The rates will still all reflect as medical on your pay stub, and the cards will have Capital RX prescription information on them. So you'll have that one card to take with you when you visit your providers and or when you go to fill your prescription at your local pharmacy. All right, here's a comparison of the PPO, or as we had referred to it previously, copay plan, and compared to the high deductible health plans. And our PPO plan or copay plan does vary depending on what type of employee group you are from. And so this chart just kind of highlights some of the differences, but they're all pretty comparable. But for example, the high deductible health plan includes a UMS contribution to your health savings account, which is prorated each pay period. UMS will remit monies to your health savings account for an annual total of $1,000 for individual or $2,000 for family coverage. And that helps offset some of the deductibles and coinsurance that you might have. The HSA is an account that will be described in more detail in later presentations, but just wanted to give you a high-level overview. This slide highlights our flexible spending accounts. And so this is different from the health savings account in that this plan is only available, the healthcare FSA, let me be clear, is only available if you have the PPO or copay health plan. The maximum contribution for 2026 is $3,400 per year. Eligible expenses include glasses, contacts, your copays, any coinsurance you might have. It can even be used for over-the-counter medications and cough syrup or Band-Aids, things like that. And you can set aside with the healthcare flexible spending account, this money is front loaded and it's available to you beginning early January for that full amount that you elect. Unlike with the dependent care FSA, which is more of a reimbursement account and pays as you go. So each pay period, depending on your election, you'll be setting aside money into that dependent care account, but it's not pre-funded or front-loaded. So you'll have to file your claim as you pay for your dependent daycare expenses for anything such as daycare, after-school programs, or elder programs as you go. The maximum contribution did actually increase for 2026 for the first time in like 15 years, and it is $7,500 per year. And with the healthcare FSA, I did mention both of these are use it or lose it accounts. However, with the healthcare FSA, up to $680 of unused funds can be rolled over into the next new plan or calendar year in accordance with applicable IRS regulations. And just some important reminders to note. You don't have to make any changes to your benefits program or your benefits if you are satisfied with your plans, with the exception of the flexible spending account, which requires you to re-enroll every year and confirm your election. So even if you have rollover funds rolling into your account, if you want to increase that amount, you have to go into your employee self-service and open enrollment event and make an election. Also, if you elect the high deductible health plan with the health savings account, IRS regulations do not permit you to have the healthcare flexible spending account, although you are still able to enroll in the dependent care flexible spending account. Open enrollment is a great time to review your life insurance beneficiaries to ensure that they are up to date. For the retirement plan beneficiaries, please contact TIAA directly to make those updates. Okay. As we stated earlier, we will have one ID card. And this is a change because last year Cigna went with a virtual first card model, and you actually had to connect with customer service and request a physical ID card if that was something that you want. In our partnership with Anthem and Capital RX, we will be mailing out the physical enrollment cards to everybody. And again, they will have both the medical and prescription benefits on the card. So it will be that one card that you take to your provider and also to your pharmacy to pick up your prescription. You can also note that the electronic ID card will be available around December 15th. So you can go scope that out while you wait for the physical cards to come in the mail, which should be around end of December, very early January. Okay. And I did state this, but it bears repeating. So if you do not want to make any changes, the plans that we're offering through Anthem are comparable to the plans that we offered through Cigna. Really, the only thing that is changing is the third-party administrator. They are going from Cigna to Anthem. And so therefore, as with years past, if you are happy with your benefit selections, you do not need to make any changes to your benefits. Other than pledge your flexible spending account contributions, which must be done annually, as that is an IRS regulation. All right. And on this slide, we have our open enrollment resources. And as we mentioned earlier, the Employee Benefits Center is available to take any questions or concerns that you might have. And their information is located at the bottom of the screen. They can be reached locally at 207-973-3373 or by email at benefits@maine.edu. We also have a lot of our information pointed on a University of Maine System SharePoint site, as well as the public site, so you can review information with your spouse or partner. I did just want to add that during this implementation, we wanted, our wellness program is updating. And so traditionally, where we had a level 1 and level 2 set up, and that level 1 activity was a preventive screening or health coaching appointment. And what that did was keep your premiums lower. That level 1 is going away. Now you can do the health coaching through Anthem or have your preventive screening, and you'll get rewards that will be similar to the way we handled the level 2 program, where you can earn up to $100 for employees and up to $200 if your spouse participates as well. And so those are my updates. I am going to bring up Anthem's presentation, and I welcome Christina from Anthem to do her share of the presentation. Go ahead, Christina, say hi to everyone.
Thank you, Carla. Hi, everyone. Thanks for having me today. Carla, just give me a thumbs up. You can hear me. Awesome. Okay, so as Carla said, my name is Christina Hall is my new married name. My Zoom name hasn't changed yet, so we can go with Christina Meridian for now. But I am your Anthem representative through implementation. Joining me on the call is Becky Craig. She will be the account manager once you all go live in January. So Becky and I are here to support the transition and then obviously support Carla in the HR team once the effective date is here, and happy to help you all however you need. So Carla, if you want to go to the next slide, we're going to talk a little bit today just about some of the basics when coming to Anthem. So we'll review our network, how your health plan will work, and then we'll explore the different healthcare plans that you all have. As Carla mentioned, they should really look and feel very similar to what you have with Cigna. We worked hard to match the benefits as close as we could, so there wasn't really any change or much change for you all. There were some enhancements in the tools and resources that we'll talk about, and then I can answer any questions. So if we go to the next slide, it talks a little bit about Anthem's national network. So Anthem and our national Blue partners. And I've been explaining the Blue partners comes, we say that because in some states it's Anthem, some it's Anthem Blue Cross Blue Shield, and some it's Blue Cross Blue Shield. So nationally, we're recognized as the Blue brand. And I'll talk about your ID card in a little bit and how they know that it's the Anthem Blue brand. But in Maine, you're Anthem Blue Cross Blue Shield, but nationally, so there's 1 in 3 Americans with a Blue plan, over 115 million Blue members, and you all are the members. And then there's over 2 million Blue Cross Blue Shield contracted doctors and hospitals nationwide. So very vast network. No matter where you are nationally, you should have coverage on your PPO plans. There's also a 2 times larger behavioral health network than what our competitors offer when you come to Anthem. So again, in a time of need, should you and your family need a behavioral health provider, you will be supported no matter where you are. On the next slide, we talk about Anthem Blue Cross and Blue Shield in Maine. So there is a local team here in Maine who is backed by our national enterprise, but local to South Portland. So in Maine, there's over 370,000 members on our Anthem Blue Cross and Blue Shield health insurance. We have served in Maine for about 87 years. And in South Portland, where Becky and I both work, there's over 500 Maine-based associates. So again, local team here to support you right in Maine. There's over 6,500 doctors in our network. It's okay. In over 32 hospitals. And there's also over 98% of our claims are paid in network in Maine. So as Carla mentioned, we have reached an agreement with Northern Light, so these numbers stand true today, and things you should have access in Maine no matter where you reside. On the next slide, we talk about your ID card a little bit. So as I was mentioning, if you see on the bottom right-hand corner of the ID card, there's that little PPO suitcase. So that PPO suitcase is nationally recognized. That's how providers will know that this is a Blue plan, regardless of where you are nationally. Every person in the household or on the plan will have an ID card with their name on it. So subscribers and members all have their own card with their own names on it. If more cards are needed, they can be requested in the Sydney Health portal. I'm going to take a sip of water because I have hiccups. Excuse me, thank you. And ID cards will have Anthem and Capital RX information on them. So as Carla mentioned, your pharmacy vendor and your health insurance are separate, but you're going to have one ID card with both information on it. So when you get to your provider, the pharmacy, you just have to show the one Anthem ID card. Your ID cards will be branded with the University of Maine System logo. And again, that PPO suitcase is nationally recognized. So if you're traveling out of state, no worries, you still can use your benefits wherever you are. And then on the next slide, and if we advance, we talk about a little bit of just the basics of how your health plan is going to work. So again, with you all being offered a PPO plan and a high deductible health plan, your plans include access to the largest nation of network and doctors and hospitals. The largest network of doctors and hospitals nationwide. There's convenient access to virtual care, and your health plan details will be available online from the Sydney Health mobile app or on anthem.com. Your plans include coverage for preventive care, including regular checkups, screenings, and shots. And there are various health and wellness tools that will support your well-being and help you reach your health goals built into your medical plans. We'll talk more about those later. And there are also benefits for urgent and emergency care wherever you are. On this next slide, we talk a little bit just about the basic health plan terms And I say basic, they're not that basic, but they're very common. And so a copay, unless you're on, so the high deductible health plan does not have copays, but if you're on a PPO plan, a copay is a set fee that you'll pay at a doctor's visit or when you're picking up medicine. Your coinsurance is your share of the cost for covered healthcare services after you've met your deductible and before you've hit your out-of-pocket limit. Your deductible is a set amount of money that you must pay each year for covered healthcare services before your health plan starts to share the costs with you. And once you meet that out-of-pocket limit, that's the maximum amount you pay for covered services each year. So once you reach that limit, the plan covers the rest. Your copays, your deductible, and your coinsurance all count towards your out-of-pocket limit. So it'll accumulate as you use it throughout the year. Out-of-pocket limit is met, and then there's no more cost sharing. So now we'll talk about as mentioned, you all have a PPO plan. So the PPO plan is the most flexible. You don't have any gatekeepers, as we call them. So you have flexibility to go to almost any doctor or hospital. Obviously, in-network benefits are more cost effective, but should you need to see an out-of-network doctor, you do have out-of-network coverage benefits. There is no requirement to have a primary care doctor appointed, and there's no referrals needed to see a specialist. So a PPO plan is the most flexible for you all. And when you look at this slide, I know Carla had something similar, but we wanted to really highlight, and Capital RX has it in their presentation too. We really wanted to highlight how little has changed when coming to Anthem. So you'll notice all of the deductible amounts are matched, the co-insurance is matched, out-of-pocket and co-pays. We wanted to keep things as consistent as possible. So if you look, you can see the 3 PPO options that you would be on one of those, or the HSA options are all here and the same. And we talk a little bit more about that HSA. So if you choose the HSA option, you are able to set aside pre-tax dollars to pay for qualified healthcare expenses. And you can determine that pre-tax amount taken out of your paycheck, and you can change your contribution anytime as well. Your employer does contribute $1,000 per single account and $2,000 per family account. So the money's going in tax-free, it's earning interest, and it comes out tax-free for the eligible healthcare expenses. Also within HSA, on the next slide, we talk about how there's just, you will get a new debit card if you have an HSA account. So a new debit card will come in the mail. Make sure we are trying to remind members, don't throw away any envelopes that come between now and the new year. We try to keep these cards inconspicuous, of course, because it's a debit card. So the envelope isn't that recognizable. So just make sure to check any envelopes that are coming in. So you'll get your new HSA debit card, and you can use that to pay for qualifying healthcare expenses. You can also roll over your unused funds from year to year. They don't expire. And the HSA funds are yours to keep. So even if you switch a health plan or change jobs or retire, that money is not expiring. On the next slide, we highlighted the increments this year. So there's a change in the HSA dollar limits from 2025 to 2026. So we'll just leave this for a minute and I'll let you take a peek. And then now we'll talk a little bit more about the tools and resources and some enhancements with your medical plan with Anthem. So the Sydney Health mobile app, I touched on this briefly earlier. Or you probably heard me say the name Sydney. So Sydney is our mobile app. I recommend all of you download this if you have a smartphone. If you don't have a smartphone, don't worry. Everything that I'm talking about on the mobile app is on anthem.com as well. So you can get on your computer and use it that way. But in the Sydney mobile app, you can do various things to make your health benefits easier and to keep track. So Find Care is our tool. That is our Find Provider tool. When you open your app and you use Find Care, it'll know your location and pull up the doctors closest to you. And you also can compare cost in that tool. You can learn what's covered and check your claims within the Sydney Health app and see how the claim was applied to your deductible, what your cost sharing is after your deductible is met, and also you can view explanation of benefits and get that level of detail in the app as well. My favorite feature is that I can view and use my digital ID card, so I don't have to carry that around with me. At any time, you go into the app and click your ID card. You can also email it from the app or text it if you need to get it to a spouse quickly. All of that's available right in the mobile app. Check your plan usage, chat with member services. So if you're not in a position to pick up the phone and call member services, there's a chat feature in the Sydney Health app. And you can access virtual care to talk to a doctor via chat or video session. I'll dig more into the virtual care options in just a minute, but we do have a lot of virtual care through the Sydney Health app and anthem.com. You can use the symptom checker to assess your symptoms and use My Health Dashboard to find wellness tips and personalized action plans. Within the Sydney app, they have healthy living videos that you can access. There are different recipes sometimes that you can find in there. So when it says connect with community resources to find no cost and reduce cost programs, those are some of the additional support and guidance tools just built into the app for you all. And lastly, you can simplify your family's health data with My Health Record. So you can store and share health information all in one place with My Health Record in the Sydney Health app. And on this next slide, some of the different virtual care options that we have here are primary care. So you can have video access to a primary care with an appointment and schedule that same provider on an ongoing basis. You have access to 24/7, 365-day urgent care with no appointment needed through the Sydney Health app. There's condition management by a coordinated care team. There's behavioral health care within the app. You can do your wellness visits. And there's also different specialized support. So you have access to clinical expertise for support when and where you need it the most. And on this next slide, we talk about one of our virtual care providers, Live Health Online. So Live Health Online is your virtual doctor. Again, receive 24/7 support in the Sydney Health app, but with Live Health Online, you can have a video visit with a doctor on your mobile device, and there's a $0 cost share for University of Maine System members to use this virtual Live Health Online, especially for your preventative care appointments. And when we talk about the rewards in a little bit, it'll make sense how the claim process the reward to trigger once you do some of those preventative visits. But with your Live Health Online doctor, they address anything from COVID and flu symptoms, cold and fever, minor rashes, sore throat, or headaches. And on the next slide, I believe, yes, this is where we talk smart rewards. So as Carla mentioned, your rewards platform is changing just a little bit. And really by changing we have the opportunity to take away level 1 for you all. So now you have access to these 3 different pillars of types of activities you can complete, and you can earn up to $100 for employees and $100 for spouses. So as mentioned, your preventative activities give you a $50 reward, and those are processed once you go. If you go for your annual well exam or you go for prostate cancer screening or a mammogram, the claim will process and that'll trigger that $50 reward just because you went and had that appointment. The digital column in the middle, this one is more based on your engagement. So when you download the app, it'll ask you to complete a health assessment, or if you go on anthem.com, another option is to complete an action plan in there. You can track your nutrition, your steps, and your sleep. The Sydney Health app is compatible with Apple Watches, Garmin watches, and Fitbits. If you don't have any of those smartwatches, you have the option to manually enter your steps or your sleep, so you don't lose out on the opportunity just because you don't have a smartwatch. And then the last column is health coaching. So you'd get $25 if you meet with a health coach, which is also we have well-being digital coaches that are built into your benefits, and that well-being digital coach, once you meet with them, you get your $25. Another program that we have built into your medical benefits is our diabetes prevention program. So we partner with LARC, and we offer a 12-month weight loss program that will help you lose weight and reduce your risk for type 2 diabetes. These 24/7 coaches help you manage stress, eat healthier, sleep better, and increase activity. You engage with the LARC health coaches, and then they continue to reach out to you as needed. As said, you work together over a 12-month period of time, and just they help you meet your goals. And then on the next slide, we talk about our behavioral health resources. So we've spent a lot of time, and especially our local Maine team, working on our behavioral health resources and vetting behavioral health providers to make sure that you and your members are being supported in a time of need and crisis. It is also, I want to note that these providers will guarantee either a same day or within 24-hour virtual appointment. So again, when we know when you're in or your family member's in a time of crisis, there's no time to waste. So as we've been meeting with these various providers, we've made it very important to stress that availability and urgency in that availability is very important. So some of these providers we have listed on the screen are who you can have access to through behavioral or as you need for behavioral health resources. They help with things like stress and anxiety, depression, substance use, and eating disorders. And on the next slide, we talk about an additional program that's built in, building healthy families. So with your medical benefits, we have 24/7 health coaches again. They'll reach out and help you, whether they're helping you with different screenings or tracking. They have various tools that will really just help for anywhere from preconception, fertility, pregnancy, and even early childhood. And we have extensive content libraries covering the topics, so they'll support diverse families, including single parents and same-sex or multicolor couples on their path to parenthood. So when you go to anthem.com or when you go to the Sydney Health app, you'll see Building Healthy Families on your My Health dashboard, and you can engage with them as you need. And last but not least, I want to highlight our Anthem Health Guides. So the customer service model with Anthem, we have our standard customer service, and then we have a level up called Anthem Health Guides. And this is a concierge level of member services that the University of Maine System felt was important that you all have. So these health guides will help answer your questions and walk you through the healthcare system so you have the support when you need it. They'll help you find the right benefits for your needs, and they'll help you stay on top of appointments. So they actually make outreach to members. If they notice a couple appointments have been missed or canceled or rescheduled, they'll reach out to you and see if you need a provider that's closer or if you need help rescheduling those appointments. They can even help you compare costs for healthcare services. So they are in the States, the call center for University of Maine System is in Virginia, and the number that's here and on the next slide, just highlighting how to connect with member services, those are the phone numbers to get in touch with the Anthem Health Guides. They opened phone lines on November 3rd, so they are ready for you to call in if you have any questions. You will tell them what plan you're on within the University of Maine System. Um, or if you want to explore the different plans, they can help with that too. They can't do specific member questions quite yet because we don't have enrollment information, but they are able to support and answer any open enrollment questions you might have at this time. So thank you. If there are any questions, I'm happy to take them. Again, once you get your member ID in the mid-December, you'll be able to register at anthem.com or download the app. But in the meantime, if we can help, please let me know. And Carla knows how to get in touch with me as well.
Thank you, Christina. All right, and just queuing up Capital RX's presentation. And with us today to present on this is Joshua from the Capital RX team to discuss the pharmacy and prescription benefits. Go ahead, Joshua.
Thank you so much, Carla, and thank you so much to University of Maine System for having me today here. So yeah, as Carla mentioned, my name is Joshua, and I am from Capital RX, and I want to welcome you all to the Capital RX family today. So Capital RX, we are a pharmacy benefit manager or PBM, and our role is to oversee your prescription drug benefits under your University of Maine System plans. So Capital RX, we're not a pharmacy. We simply process your drug prescription claims on behalf of you and your employer. And we are an independent company that works directly with pharmacy providers and drug companies to offer this service. Now, in the 2026 pharmacy benefits, we want to emphasize that it is going to continue being the same great coverage that you currently have with just additional support. So your plan designs like co-pays, co-insurance, and deductibles out-of-pocket maximums are not changing. They will remain the same as what you currently have under Cigna through 2026. Prior authorizations, any existing prior authorizations that were previously provided by Cigna and are active as of January 1st of 2026 will be moved over to Capital RX. So Capital RX will be transferring any current eligible mail order prescriptions to our Costco home delivery pharmacy and our Costco specialty pharmacy for members. So any prescriptions that are ineligible for transfer may be expired prescriptions, prescriptions for controlled substances, prescriptions with zero refills remaining, and prescriptions that are new or renewed and have not been filled through the pharmacy yet. So we do want to ensure that you will have a smooth start for 2026. So University of Maine System is implementing continuation of therapy. So, to ensure a seamless transition to Capital Rx, the University of Maine System implemented continuation of therapy program. So, what does that mean? This program allows most members to continue receiving their current medication without interruption for the first 90 days, following our go live date of January 1, 2026. So if your current medication requires a prior authorization under Capital RX or is not included on a Capital RX formulary, you will be able to fill your prescriptions without disruption through April 1st of 2026. Now, in February 2026, letters will be sent to the members impacted by these changes. So these communications will provide 60-day notice to take any necessary actions to maintain therapy or transition to an alternative medication. So we also like to highlight our award-winning customer service team. So we have a 24/7, 365 days a year team that is able to deliver unmatched experience to you all. So we have an average time to speak to a pharmacist, about 8 seconds. You are able to reach a customer care representative with 18 seconds. And then of course we do have a 91st first call resolution. We want to ensure that we answer any questions and assist you with your medication transition as much as we can. And that's why we have that high percentage of first call resolutions. 91% of our representative are pharmacy techs. So if you are able to feel comfortable just asking in those questions that you feel comfortable with a pharmacist at the pharmacy, and our team will be able to assist with those questions. And then what to expect in 2026 with Capital RX. So previously you had your prescription plan through Cigna. It is now currently going to be with Capital RX. And members, as previously mentioned, will receive a new combo medical and RX prescription ID card from Anthem in December. Effective January 1st of 2026, members will need to present this ID card to your pharmacy for all your prescriptions. So make sure that you provide that information to your pharmacy. If members have active refills on their existing prescriptions. So you won't need to obtain a new prescription with this change. As long as that prescription is active, they can continue filling your medications at your retail pharmacy. So we have a wide range of pharmacies. We have over 65,000 retail pharmacies that are networked with Capital RX. University of Maine Systems has a broad network, meaning members can fill their prescription at any retail pharmacies without restrictions or requirement within the broad network. The network includes pharmacies like Walgreens, CVS, Hannaford, your Northern Light Pharmacy, Walmart Pharmacy, local independent community pharmacies, and many more. And then again, just please ensure to present that new ID card when you receive it in the mail to those pharmacies if you will continue using your same pharmacy. We want to make sure that they have the correct and processing information to process your medications. And so we have more options now for maintenance medications. So you are able to fill a 90-day supply for your maintenance medication at any in-network retail pharmacy, in addition to your Costco mail order pharmacy. So you can have your doctor send the prescriptions over to retail and just ensure that you are now able to fill that 3-month supply worth of maintenance medication at any in-network retail pharmacy. So we partner with Costco Pharmacy for home delivery medications. So Costco mail order delivery for non-specialty maintenance medications will come directly from Costco mail order pharmacy. The Costco specialty pharmacy will fulfill all specialty medications. So any specialty medication will come from that Costco specialty pharmacy directly. And then an important call out that we do like to mention is that you do not need a membership to fill your prescription at Costco. So of course, if you have a membership, that's great. But if you do not have a membership, do not feel the need or necessity that you need to create that membership with Costco. That is not a requirement. So how to get set up with Costco. So University of Maine System members can register with Costco mail order either online or by phone to be eligible. You can also reach out to your prescriber's office and update your mail order pharmacy provider to Costco. And then of course, you must set up an account with Costco before any medications will be shipped. So what are the benefits of using mail order instead of retail? So The mail order provides greater savings on most prescription benefit plans. And of course, you will save it typically time spent traveling and waiting at the retail pharmacy. So those are just a few benefits. And Costco Specialty Pharmacy. So Costco Specialty Pharmacy is not the same as Costco mail order. They are two separate pharmacies. And the way that you can get set up with Costco Specialty Pharmacy, you can set up with either registering online on the Costco Specialty Pharmacy portal, or you can contact the customer care service for Costco Specialty and they'll be able to set you up as well. You can, in addition, you can reach out to your healthcare provider and update your specialty provider to Costco Specialty, just to ensure that they are sending your prescriptions moving January 1st of 2026 moving forward to the correct pharmacy. Now, Costco specialty pharmacies can only fill specialty medications. So specialty medications prescription must be sent to that Costco specialty pharmacy, as they are the only pharmacy that can dispense these specialty medications. So what do you need to know to save and stay well? So at Capital RX, your health is our priority. So we developed the Liberty Formulary drug list to provide access to a comprehensive selection of medications designed to meet your needs while helping reduce your overall prescription costs. So the formulary includes drugs covered under your pharmacy benefits. Your pharmacy benefit covers a wide range of prescription medications. However, certain exclusions may apply. So if a medication is not covered, an alternative option may be available. And then, of course, for questions about your specific coverage, you can call our Capital RX team at 833-554-4750. And that phone number is already available. So the phone number, because our customer care team has been available since November 3rd of 2025. So you can feel free to jog that number down. And again, that number is going to be on this presentation and in a couple of slides moving ahead of us that will have that number and that information as well. So there will be some changes in the formulary for January 1 of 2026. However, these changes, they will be minimal, but any members that are impacted by formulary or network changes will be notified by Capital RX with more information and any actions that they need to take. So you may receive a letter in February of 2026 if your prescription drug is no longer on the formulary list, if you currently are receiving a drug via mail order or taking a specialty medication, if your pharmacy is out of network with Capital RX, and if the medication you're currently on requires a prior authorization under Capital RX. So, as the team mentioned throughout the previous presentations, we also do wanted to highlight the pharmacy benefit change or unchanges, I should say, that will not be occurring, or changes that will not be occurring in 2026. Um, Deductibles, out of pockets, copays, coinsurance, specialty copays, these will all remain the same throughout 2026. So we just kind of wanted to highlight this section here to assure you that there will not be major changes for for 2026. And then what's available now? So we have a great tool, a website that you all can utilize while you're on the open enrollment process, where you are able to find an in-network pharmacy, estimate medication costs, and review any FAQ documents. We will be giving a brief presentation demo towards the end of the presentation, just so you all can see how the tool works. And as previously mentioned, the phone lines are already open. So on November 3rd of 2025, these phone lines became available to assist University of Maine System populations. They are trained and are aware of the open enrollment process and are ready to answer any questions that you may have. And again, as a reminder, we are staffed by licensed pharmacy professionals. So any questions that you may be wondering, that if you can ask, maybe you have a particular questions on your particular medications, our team will be able to answer these questions. So please feel free to utilize that phone number there, and our team is ready to answer those questions. Now, as for general benefit questions, our team, yes, they can answer general benefit questions. If you have any specific questions on your medication history and their information that your medications that you're taking now, they will be better equipped to answer these questions effective January 1, 2026 moving forward. And we will have the history of your medication and all that information on our end post 1/1 of 2026. All right, so when you contact Capital R's customer service, that is our number there again. Please feel free to jot it down, take a picture, whatever you see fit. When you call in, it's pretty simple. You would just have to press the number 1 to identify yourself as a member, follow the prompts to confirm your personal information, and then we have the options to either speak to a Costco mail order representative, a Costco specialty representative, and a customer care agent from Capital RX that can assist with general inquiries like copay amounts, coverage questions, and any other questions that you may have. All right, and we do have additional tools. So we have, besides our customer care team that's open 24/7, or 24 hours, 7 days a week, we have an additional tools, which is our website. So our Capital RX website, effective 1/1/2026 moving forward, you are able to register and view information like, again, find your pharmacy, view your claims history, view your accumulators, and any additional information that you will need to or would like to review will also be located on this website, and you can register effective January 1, 2026 moving forward. And then of course we also have a mobile app. So if you are not interested in the portal, but you are more interested in just having this information on the go, you can go to the Capital RX app, and that is available in Google Play Store and also Apple Store. All right, so I do want to go ahead and show a quick demo on the open enrollment site, and then we can come back for to answer any questions that you may have.
I'm gonna stop sharing, Joshua, and turn it over to you.
Okay, perfect. Thank you. And just need that confirmation that everyone can see my screen. All right, perfect. So this is the University of Maine System open enrollment site. So you can get the answers that you need, of course, before your enrollment, just to find out what plan fits you best for you. And of course, when you go below, you are able to select the plan. So there are all the plans that are available. These are all the plans that are available for University of Maine System. And I'm going to go ahead and just do a quick demo and select on the first plan so you all can see the tools that we have. So before I continue to define pharmacies, we have additional resources. So we have it below the plan documents like the Costco specialty if you need more information on Costco specialty, our welcome member booklet, any information on Capital Rx in general, as well as additional information on prior authorizations and step therapy that you may be interested in. So when we go to this website and we want to go ahead and find a medication just to see if the medication is covered, to see the prices in the area, we're going to go ahead and select the button start. And we're going to plug in our zip code. So I'm just going to use 4401. Let's see. Actually, Carla, is there a particular zip code for this group? I just want to make sure that we use the.
We are statewide currently, but you can use the Bangor area zip code because that's the one that's coming to my mind right now, and it's 04401.
Okay, thank you so much. All right, so you have the option to select the pharmacy in here in this section to see if the pharmacy is in network, or I want to actually search other pharmacies besides the pharmacy that I'm using because I wanted to see what other pharmacy can provide this medication at and at what price. So I'm going to go ahead and search my medication. So the medication that I want to search for is for amoxicillin, and I'm taking the 500 milligrams, and I want to go ahead and search the day supply. Yes, it's 30. And then, of course, we have the section date. Now, make sure it is going to default to 1/1/2026 because that is when the benefit starts. So you want to go ahead and utilize that date or any day moving forward to ensure that the benefits or the correct pricing is pulled within the coverage. Now, it's also going to ask for additional information here just to kind of towards or cater towards the information that I'm looking for. And I'm going to go ahead and hit search. All right. So in the area, we are able to see multiple pharmacies. So I'm able to see the pharmacies that has this medication or the price that these medications are at each pharmacy. I'm able to compare those prices, see where they're at, and basically obtain the information that I need to get to that pharmacy. So I am interested. It looks like the best price that I see is Hannaford Pharmacy here. So I'm gonna go ahead and click on Hannaford just because I want to obtain that information. And oops, something else popped up there. So let me go ahead and try that again. I'm gonna click on the medication and it's going to take you to the pharmacy details. So it's going to say the name of the pharmacy, the address of the pharmacy, the phone number. It's going to have the hours of operations. And of course, it's going to give you a brief description of the medication that you inserted initially. And then below, it's going to give you kind of a small interactive map here that you can see the pharmacy location. So that is the tool to find the price. I do also want to mention for those plans who have deductible, you also have the ability to use this toggle to show the pricing after the deductible has met. And of course, this might be a little bit different just because I selected that first plan, but it is connected to the plan itself where you are able to just utilize that toggle if you want that additional information. Okay, and that is it's pretty simple on how do you utilize that tool. Of course, if you all have any questions, we are definitely available. As I mentioned, our customer care team is available and aware how to guide you through these websites. So please let us know if you do have any questions. And thank you so much for your attention.
Joshua, can you explain why gender might matter on that screen when you were filling out?
Yes, and let me see if I can go back and pull it up here. So the reason why we want to include the gender, and my apologies, I don't think I'm sharing my screen, but let me just pull up the information. Okay, there you go. Now it's playing nice with me. All right, I have it here. Okay, perfect. So the reason why we want to select gender is because a lot of medications are gender and age specific, and they might have age limits. So let's say, for example, if you are prescribed a medication by your doctor, but the medication can only be used for members over the age of 18, you want to make sure that you are inserting the information so the system can pull that particular medication that you're looking for with that age edit, and it won't give you an error stating, hey, you didn't provide your age, this medication is not covered for a particular age. So you want to make sure that you put that information there because it will pull the latest and the correct information from the system and it will pull the most accurate coverage. So that is why we have that gender and age. It's more to pull the information accordingly from the system for those medications that may have gender edits or age limitations.
Thank you.
Of course. Any other question on the portal or any question in general, be happy to answer as well.
Awesome.
All right.
I'm
Well,
gonna,
thank you all. I do. Let's see here. I think there's a question in the Q&A if I'm not mistaken.
it says, the question says, well, one question is, how do you find the portal again?
So the portal can well actually Carla, correct me if I'm wrong. Will the presentation be posted?
Yes, we will send these slides to you directly.
Perfect.
And you'll have the link in the slide
Yes,
information.
the link is in the slide. The slide is interactive, so you can press on it. It will take you directly to the link. I have another question here. How long does it take to the shipping for the prescription typically take? So the prescription shipment can take up to anywhere up to 7 days, the latest. Now, of course, it does depend if you, let's say if you need expedited shipping for whatever reason, if the medication is a medication that needs to be temperature controlled. Costco does a very good job with sending those medications in a very timely manner to ensure that these medications are protected by any climate. They also have very good packaging to ensure that these medications are protected as well. And then there's one more question. Medically concerned.
So what if they were doing some sort of gender affirming care transition, and what would they put into the demographical information on that
Yeah.
initial screen you showed?
So that is a very good question. And let me go back here because there is an option. And let me share my screen again. My apologies. I should have shared that. All right, perfect. So in the gender, there's an option for gender male, other, or non-binary. So you do have those options there as well. All right, so great questions. And again, of course, you're very much welcome. And of course, our customer care team, as I mentioned, they are already available and they're ready to receive University of Maine System's call. So please feel free to utilize our team as well, and they are more than happy to answer any questions that you all may have. And thank you all for having me.
Appreciate that, Joshua. I'm going to take over the screen share, and I am going to, this is our final presentation of the afternoon here. This is so ComPsych is not a new benefit effective January 1st, 2026. So everything else we had reviewed to this point is new effective 1/1/26, but we actually introduced ComPsych effective January 1st, 2025. That being said, as we've been going through these presentations, one of the things we have heard is that people aren't necessarily aware of the employee assistance program and the fact that ComPsych offers support over and above the traditional employee assistance program benefits, which typically center around behavioral and mental health related things. They go a step further and cover the holistic whole person health, venturing into work-life balance, things like that. All right, next slide. So today, and with me today is Deb Palma. She is from ComPsych, and she will be presenting the rest of this presentation. So I appreciate that. Deb, I just gave a quick overview that though we've had ComPsych for a year, as we've been going around, people have been admitting that they really don't know or really haven't heard that much about this benefit. So that is one of the reasons why we're covering that information in today's presentation. Would you like to take over the screen share, or would you like me to continue to, and you just tell me to move forward?
How about I tell you to just move forward if that's okay.
Perfect.
All right, great. Okay, so did you go over this already in terms of what we're going to be discussing tonight? Okay, all right, thank you. All right, well, thank you all. I'm happy to have the opportunity to review with you both ComPsych as well as our program offering guidance resources. As Carla mentioned, this is something that went live this past January. So first, I'll just do a quick overview of what ComPsych is or who we are, emphasizing the fact that we do take confidentiality quite seriously. We'll then go into the program offerings from a high level, and then I'll go more into detail over each of those offerings through the coming slides. And then I will end it by going over just that experience in signing up for guidance resources. And from there, we can take any questions. However, with that being said, I find that if someone has a question and doesn't want to wait until the end, I'm more than happy. It's not like we're super pressed for time. We've been kind of going through these with extra time available. So I'd like everyone to just kind of chime in either through chat or just coming off of mute and letting me know if they have a question. Okay, so first off, who is ComPsych? ComPsych is a behavioral health company that has been in existence for over 40 years. We've supported over 160 million lives, and probably thousands of customers have put their trust in us to present a meaningful program to their employees. We serve over 200 countries. In terms of Maine, that doesn't really apply much because it is Maine. However, I know there are some French Canadian speakers out there. So there is the option of switching the language to French Canadian, Spanish, or any other language. We have, I think, 40 or so language options out there. So you can go in and pick your language. Next up. Okay, in terms of guidance resources, so guidance resources is a program offered through ComPsych, and this is the program offering that we have for the University of Maine Systems. We follow the philosophy that well-being is addressed by 6 pillars of health. There is the pillar of mental, emotional, physical, legal, financial, and community. So we have areas within our program offering that address all of these pillars and are able to meet an individual where they are and what areas they're interested in tackling or learning more about. As I noted before, it is all confidential. You have complete access to the program, but it is voluntary. You do not need to get involved in this offering. The confidentiality is huge, as well as this is a program that is offered to you at no cost, and it's at no cost to you as well as any of your household members that are living with you. It's completely separate from your insurance, so the two aren't combined or influence one another. This is a standalone benefit that, again, is at no cost to you, and you can use it yourself as well as anyone that lives in your household. Okay, so from here, I'm going to just quickly go over from a high level all of the different components of your program offering, and then the corresponding slides thereafter will go into like more detail of what those services are. So in terms of when you reach out for support through ComPsych, you can reach out by phone or through our website to get connected on a variety of different offerings. All of our phone calls are answered by a master's or above level clinician or professional, as well as those that man our chat and engage in our video conferencing. So you can feel comfortable knowing that you are dealing with someone with the mental health and well-being field, as well as attorneys and financial advisors. So anyone you're speaking with is master's level and is able to assist even during that intake process. So when you do call, you'll be calling for a variety of reasons. You have up to 6 sessions of counseling per person, per issue, per year, all at no cost to you. So what I mean by that is, say you're tackling some issues of depression and end up wanting a counselor to help you address those concerns. You could meet with your counselor regarding your issues of depression. Say you go through that, have a great experience, are able to close that out, and you're dealing with that okay, but you hit another little bump where you're going through a divorce or you're struggling with issues with an aging parent and you're feeling stressed and anxious again. You could reach out and have another block of sessions, again, at no cost to you, where you could work on those issues with a counselor. Another option that we have is the 5-session health and well-being coach. So these are telephonic sessions that a coach could work with you on different well-being topics. And we'll go a little more into that in a little further, but that is a 5-session flexible model. So with that being said, you have your intake, you have 4 other sessions after that, and between you and your counselor, you can determine the frequency in which you'd like to meet. Another offering that can help support coaching as well as counseling, or be used just as a standalone support for you, is computerized cognitive behavioral therapy, which is a program within the offering. This is referenced as CCBT, and basically it's a module on your phone or on the desktop that you would access, and I'll go into detail as to why you would use it, but it can be a nice complement to working with a coach and or a counselor, or again, all on its own. I mentioned those 6 pillars of health. So this is really where the next 3 will come into play. It's Family Source, Legal Connect, and Financial Connect. This is a great service. Again, as Carla was saying, some people weren't aware of the full breadth of the offering, but with this portion of your program, you have access to ComPsych attorneys as well as ComPsych certified financial planners and accountants that can help you with any sort of financial and legal consultations that you may need. And then lastly, Family Source is more of like a concierge. So if you need to research anything, whether it be how you're going to pay for your kids' college, or you want to go away for the weekend, you can reach out to Family. They can help gather information for you to then go through and then just use as your references. Then lastly, we have our guidance resources online as well as an app. The website mirrors the app, so it's a pretty consistent experience no matter whether you go online or you use the program through the app. Okay, Carla, next slide. Do we have any questions through the chat? Looks like I see one. Hold on. Does the pharmacy work with drugs? Oh, that's an old, I'm assuming that's an old question about drugs. Okay. All right. So again, back to the counseling for a minute. I mentioned it's a 6-session model. So at no cost to you, you're able to reach out and get connected with a counselor. A lot of issues that people reach out to us for counseling for are around anxiety, depression, and stress. Those remain to be the 3 most common areas that people reach out for support. Another one that's become increasingly popular is relationships. So if you're struggling with your partner, you can reach out and have some counseling around that. But again, any reason that you think you may want to engage with the counselor, feel free to give us a call and go ahead and get that going. If it is more of a ongoing issue that you feel long-term counseling is needed, or your counselor and you have that discussion and decide that you would need to continue on with counseling, we can help you with the referral to get you involved with a counselor. Even before you start, if you think it might turn into that, you can work with our guidance resources team on trying to find a counselor that's within our network as well as your insurance provider network, so you have that seamless care. Next up, well-being coaching. So the counseling would be more of a resource on the mental health side. This is more on the emotional well-being side, where if you're looking for what I'd like to call like an accountability partner to help you focus on some behavior changes that you're working on, you could engage with one of our health and well-being coaches. All of these sessions are telephonic, whereas with counselors, you can meet with a counselor in person, telephonically, or have video sessions. But with the counseling, it's strictly telephonic. Some areas that you might reach out for a coach would be around time management, intentional eating, burnout. If you're working on cardiovascular issues, we have a coach that can work with you on back health. Tobacco and nicotine cessation is included with our coaching. So all of these various topics are options for you to reach out and get some support through ComPsych. Sometimes our individuals, like I was mentioning before, it's just that whole modality. You might have a counselor, but also have a coach to help with some of those other behavioral areas. And then you also might be engaged with the CCBT model, either again, all by itself or in conjunction with the coaching and or therapy. This is a tool that you would access through the site, either the website or through the app. And it's self-help resources. So you might be using this to journal, listen to some videos or watch some videos, listen to some audios, get engaged in some games, do some kind of healthy habit tracking. So these are just guided modules that you would use within the platform to help with some of your behavioral issues, such as depression, anxiety, working on your sleep, your mindfulness, or areas around stress. Okay. Any questions? I'm not seeing any in the chat. Okay. One other part of our program is called Huddles. We've gotten a lot of traction since we launched this last fall. These are sessions that are available to any of our customers. So if it is something that you partake in, you may be on a session with someone that doesn't work at the University of Maine System. So the Huddles have expanded from when we launched, but a true like huddle, so to speak, is a group session. They're focused around well-being topics such as mood management, improving your sleep, nutrition, ways to relax. So it's a interactive session. They roughly run around 45 minutes long, where you're able to just engage in a group session, talk about these issues. It's guided by one of our health and well-being coaches to help facilitate that conversation. We have a whole calendar of events that you can access through the Guidance Resources website. Go through the calendar, find a variety of different topics. We've also expanded beyond these group sessions to offer mindfulness practices. So those run roughly 20 minutes, and it might be one on meditation, it might be one around sleep, just various practices where it's like you actually are working with the person who's facilitating that particular practice topic. Thirdly, we've also added in webinars. So if you're not interested in more of that interactive option, we have webinars where you can just listen and learn, and those are roughly 50 minutes long. Again, all of these are found on the site. You can go see the calendar and go ahead and sign up right from the website. And again, these are at no cost. They're all included in your program with the University of Maine System. So back to those areas around work, life, legal, and financial services. As I noted, we have staff for ComPsych. We have attorneys that are ComPsych staff, as well as financial planners and certified accountants that are ComPsych staff. So if you're calling, having issues around your taxes or any sort of contracts, you're buying or selling a house, these are all areas that you may want to call and get some tips or run things by one of our attorneys. How you would work that is either you can request that through our online website or app where you could go and request to make an appointment, or you could also just call us up, speak with one of the Guidance Resources consultants, discuss what's going on with you, and they can get you connected with an attorney, an appointment for an attorney. The same goes for the financial services. So you have unlimited consultations with our ComPsych financial experts. Tax season will be coming up in the next couple of months. That's often a very active time of year for calls that we receive. It's a common question or a common use of that service, but you can speak with someone regarding retirement planning, how to budget. A lot of people will reach out for assistance on how to rein in their credit card debt. So again, these are all ways in which you have the opportunity to speak with a financial consultant who's a master's level or a BOV and can help kind of walk you through some of those questions and concerns and help get you on your way. And lastly, back to that work-life services. So like I was mentioning, all sorts of different ways that you could reach out to us to help you as a referral source. It's a huge packet of information. You let us know what you're looking to do. From there, our guidance resource consultants will go ahead and gather all of that information, tie it up in a nice little bow, and you'll receive a packet of information, whether that be around a more serious topic such as need for elder care or child care, or if it's something a little more lighthearted, like you want to hire a clown for a party, or you're looking to go to Italy on vacation. These are all areas in which you can utilize our work-life services. So just to think of that, if there's something you need to research, we most likely would be able to help you with that. And again, you can either call for help or you can request those services through the website. This is just a page that kind of calls out some of the different ways in which we've been able to help members by providing information. Again, whether it be something fun and kitschy or whether it be something more serious, like you're in need of some public assistance, you're not sure where to turn. With the government shutdowns, I know a lot of people are struggling, so it could be finding additional resources to help get you through this wave. But definitely, I encourage people to take advantage of that arm of our services. So I mentioned our website. We did redesign it this past January, really focusing on meeting a member where they are. There's a lot of information on our website, so it's been updated to kind of help guide you to get you to the information that you need. You can always click the Browse All services. That just brings you to all of the different content that we have, and you can just put search topics in to bring you different content, whether it be an article, a video, resources, whatever the case may be. You can always the Browse All services. That is the one I recommend people click on if they do want to get access to our huddles. You can just click Browse All services, and that'll bring you to a tile where you can then pick on the huddles. In terms of those larger areas, there's the Connect Me, Guide Me, and Assess Me. So these are the main ways in which we can really kind of tunnel down into the needs of an individual. So Connect Me would be the route to go. Say you want to engage with a counselor, a coach, or you have legal questions. You just can go right to that Connect Me. You know exactly what you want to do, and it will just ask those questions that will get you down that path and get you connected with those services. Guide Me, the one in the middle, is more, you think you might be interested in some topics around well-being. You can just go to Guide Me. It'll ask you some questions, kind of hone in on how we can help you, and then provide some recommendations as to what might be of assistance. Then there's the Assess Me aspect of our program, which you could go to, take an assessment. They're roughly 8 to 10 minutes long, where it would ask you maybe 5-ish questions around each of those different pillars of health that I mentioned. And then from there, based on how you've answered those questions, we'll provide you with 6 different paths that you can take. So it'll provide different resources, what we think might be best for you to help work on those issues. So say you end up scoring that, you were struggling with areas around mental health and emotional health. It might be that they recommend you connect with a counselor or engage with a health and well-being coach. So you'll have all these different options and all these different materials to peruse. Completely voluntary. Again, no one at the University of Maine System is going to know how you're answering those questions or how you're using our site. It's just developed to help support an individual where they are and provide recommendations based on how they've answered that assessment. So when you go to sign up, I think that would be on the next slide, Carla. There are similar processes, whether you go on our website or you go through the app. You are going to just go to those various paths to support it. Again, it's showing you the Connect Me, that right there. You can see that it goes into all the different ways in which the services we offer to help get you on your way. And the Guide Me just brings up a few different topics. And then from there, you can click on that and get more information. And then, like, as I mentioned, that Assess Me, that will provide you 6 different paths for you, one around each of those different pillars of health to help provide you support and suggestions to help tackle those areas. And then when you're a returning user, you would just go in and this is what the website would look like. But when you go to make an account, you can either, again, sign up for an account through our website, or if you don't want to go there, you can just call the University of Maine System designated phone number. And from there, it's answered by one of our master's level or above counselors who will be able to have a conversation with you, assess what's going on, what suggestions might work, and even go as so far as much to help get you connected with that counselor if you want to do it right there and then. Otherwise, we can provide you some referrals for you to think about and call at your own discretion. So Carla, can you move? Okay, so this is the designated phone number for you. Carla, this is completely Zoom, right? But I think you're sending a follow-up of the PDFs, right? So there you can see the phone number if you want to jot it down here, or again, when this presentation gets sent to you, you'll have that information there, as well as it's on your intranet site too, right, Carla? They can go to the intranet
Yes.
site. Okay, but this is the phone number that you would call if you are interested in setting up an account online or through the app. It will ask you what the company web ID is, and for you, it would be UMS. So it's fairly simple to remember. And then from there, you would just go through a couple of questions. So Carla, if you go to the next slide, I think that's noted on there. Yep. So you would go to register on the first button, the first screen, that's the area where you would do like register now. And then from there, it's going to ask for your organizational web ID. And that's where you would type in the UMS. And then from there are a few questions it'll ask to set up your registration profile. You can use your University of Maine email address or your personal email address. It doesn't need to be through the school. And then once you put in your email, you will get a link sent to you for that authentication process that's happening everywhere now. So you would just wait for that email to come. Unfortunately, they aren't available through text, but you would get that email, put in that 6-digit code, and then from there, you will be all set and registered for the site. Okay, next up. These are some of the frequently asked questions. I'll review these again, and then obviously if anyone has any questions, I'm more than happy to answer those, or if you want to chat separately with Carla, you're more than free to ask a personal. But do you need to enroll? No, you don't. As a University of Maine System employee, you're automatically enrolled or automatically enrolled to sign up with us. Again, it is at no cost. It is a free benefit, completely separate from your health insurance. It's a private standalone benefit for you, and it's for you as well as any household family members. If you do have some children that are in need of therapy, if they're 13 or over, they can request the services themselves. Otherwise, that's something that you could help in setting up that service on their behalf. And we have an arm within our guidance resources unit that can take some extra care with you if necessary, as you're trying to determine what the needs are for your child. And again, to access the program, this is the phone number you would call, or you can go to guidanceresources.com using that UMS web ID. We're available 24/7, 365 days a year, and that's both on the app, website, as well as if you should call in needing support, needing just some in-the-moment support, or if you're interested in scheduling some counseling, or even if you're, it's late Friday night, you remember you wanted to make an appointment with an attorney, you could call then. It doesn't matter why you're calling. You do have access to speak with someone 7/24. And lastly, again, I will emphasize the fact that this is strictly confidential. We do not share participation information with Carla or anyone over at the University of Maine System. It is confidential so that you have that freedom to know that you can be talking about sensitive issues and not have to worry that any of that information is going to be relayed to your employer. Okay, I feel like I
Okay.
talked very quickly, so I just want to pause here to see if there are any questions or if there's anything else I can answer for you or go into again if you want me to just kind of review one of those services in more detail.
I don't see any questions in the Q&A, but thank you, Deb. My colleagues from our vendors will stay on for a few more moments to answer any additional questions that you might have. But otherwise, the presentation portion of the seminar or Zoom is over. So now we'll just field any lingering outstanding questions. Thank you, everyone. Take care.
Carla, when individuals go to the intranet site, is there something further I can direct them? Like, or do you just say go to the intranet site? Is there a particular
Yeah.
page that I shouldn't mention?
Not particularly. Our EAP is embedded. There's a little heart icon that is coupled with wellness, which our wellness site does need some updating, but you can navigate to our employee assistance program resources through that same.
Look for the heart icon.
Yes.
Okay.
They will also, once I mail out the presentations, have a direct link to our SharePoint site, which has this information as well.
Okay. Looks like someone has a question. All right. Is Intermed in network for Anthem?
Yes, they are.
Okay. All right. Next one. Same
Thank
to
you for
you.
having me.
Can you please explain again how the co-insurance and deductibles work on the high deductible plan?
So with the high deductible health plan, you need to meet your deductible. And again, you can use your HSA account to help pay for some of those qualified healthcare expenses. Once your deductible is met on the high deductible health plan, that's when the co-insurance starts to kick in. So that's your cost sharing. So if I pull it up and look at it right now, so if it's a single, there's a $2,000 deductible. So once you hit that $2,000, then until you hit your $2,500 out-of-pocket maximum, so the remaining $500 out-of-pocket maximum, you will share 10% of those costs with the medical plan.
All right. And there's another question around accidentally enrolling and what can you do? So if you would wish to review your enrollment information and you were not done yet, what you can do is contact the Employee Benefits Center at 973-3373 or by email at benefits@maine.edu, and they will help get that reopened for you and let you know that it's available for you to continue to make changes, because really you have through November 24th to make any changes, or if you have buyers or like regrets about what you may have chosen, you can have us reopen it as many times as you wish. So a follow-up to the co-insurance versus deductible. So essentially you pay 100% of the bill until the deductible is met. Then after that, it's 10% of the bill until you hit the out-of-pocket.
Yes, you are understanding that correctly. And again, with the high deductible health plan, that's why you get the HSA card and the HSA benefits to help you pay for that, because obviously $2,000 is a lot of money. So when you start to use your tax-free deductions into your HSA account, you can use that debit card to help cover those expenses.
Yes. And then there's another question specific to part-time faculty about what happens if your deductions exceed your take-home pay. What are the options and available things you can do to help mitigate that? I would say for that question too, reach out to the Employee Benefits Center. They should be able to help you understand what's happening, and they're the least expensive medical option if you are choosing medical is the premium wise, so out of your paycheck wise, is the high deductible health plan. But there are ways that you can pay via check or other options that we can review with you if you want to pay down that balance. Right. And there's another option or a follow-up. What about preventive visits? Are you responsible for the bill at 100% also until the deductible is met? That's a
I
great
like this
question.
answer.
Yes, preventive visits are covered 100%. So you do not need to front the bill for preventive visits. Those are covered 100% by your health plan. You're right, Deb. That is a good answer.
Done for the day.
Alrighty. We don't have any more questions, any more new questions currently. I've just asked that we stay on for about 5 more minutes and see if any more filter through, and then otherwise we can be done for the day.
So did you get snow up there in Maine?
We were kind of driving through it when we were heading back down from Fort Kent for a little bit. Roads got a little slick, but otherwise we weathered it. I mean, it was really weird when the roads were the slickest. It was actually sunny outside, so
Exception.
it was so weird.
The winter
all
is
right.
coming.
So there are a few more questions. There is usually a discount when a bill is sent to the insurance company. Do you receive this on a high deductible also, or is there no discount? Like negotiated rates, I'm thinking, versus what a system would charge out of network. Is what I'm thinking that.
Yeah, if I'm understanding correctly, on the high deductible health plan, so you'll have your co-insurance. If you're using an in-network provider, then you will have the, I guess, negotiated discounted rates with our in-network provider. So using an in-network provider is definitely the most cost-effective way to go about that. I hope I'm answering your question.
Thank you. So we had someone just join, and by what date should we have continuation of care forms submitted by?
That's a great question. Heather, let me confirm that with our implementation coordinator, and I will get Carla the answer. I want to give you an accurate answer, so I don't want to guess. So let me follow up and I'll get that to Carla.
Thank you. Good question. And for people who are just joining and may not be aware, just wanting to let people know that we did settle, or when I say we, I mean Anthem settled with Northern Light Health, and as of November 1st, technically, right? Northern Light Health providers in the hospital system will be a network. So when our benefits are effective January 1st, 2026, those Northern Light Health providers will be in network.
And you said we, Carla, because you've heard me talk about it so much this week. So it feels like we.
Happy Friday, Christina.
I'm not seeing any new questions, but everyone who is still on the line, it looks like we have still around 23 participants. Do feel free to reach out. We are probably going to wrap things up. It is now 2:05. And if you have questions, just please email the Employee Benefits Center at benefits@maine.edu or reach out by phone and we'll get any questions you have to our partners and vendors from our medical and health plans and prescription plans. All righty. Well, thank you, everyone. You have a great day. Take care.
Thank you. Bye.